and its social partners to fight COVID-19 in the province. You will remember that we have been moving through phases of the strategy that we had communicated. And today we're going to provide you information focusing on matters that are a priority at the moment, with vaccine being one of them. I'm going to invite the Premier to the podium, and he's going to take you through the statement. We also have the MEC for Education, MEC Fundile Gade, who will be talking about the decision of the Provincial Department of Education in line with the National Basic Education Department. And Dr. Mbengashe is here for your indulgence also. So without wasting any time, Premier, I would like you to come to the podium, please.
Thank you very much, Program Facilitator, Mr. Squesha. Greetings to MEC Gade present here and all other MECs who are joining virtual. Greetings to HODs. Dr. Zungu is also joining virtual. Dr. Mbengashe is here. And good morning to all of you present here today. Today we meet once again to share with you, with the people of our province and everyone else watching, an update on the implementation of the Eastern Cape COVID-19 resurgence plan. The province has heightened the implementation of the resurgence plan with emphasis on the clinical response, community engagements for compliance, and increased law enforcement visibility in areas with high risk of public gatherings. As a result of the work we are doing as multi-sectors in the province, there's a general decrease in the number of active cases, daily infections, and the improvement of the recovery rate to about 92.2%, way above the national average of 82%. Our province has recorded the lowest daily new cases in the country over the last 7 days, at an average of 13% per 100,000 population. However, there remains the need for increased surveillance and vigilance to ensure that the gains are not temporal. Kona ithemba lokuba sizayoyisa le ntsholongwane likhona. I think there's a light in the tunnel. Due to the bold decision we have taken to restrict certain activities during the festive season, we are seeing a reduction in infections in many parts of our province, particularly Nelson Mandela, which has been the hotspot for a long time. They now have 324 active cases and a recovery rate of 94%. That is an important development because the region contributes immensely to the economy of our province. We see similar trends in Buffalo City Metro, which is currently dealing with 459 active cases with a recovery rate of 93%. We are working hard to get Christiani, Joe Gabi, and Alfred Nzo over the 90% recovery rate, so we can start looking at easing regulations to get our people back to work and our children back to school. The government business continuity, a work stream focusing on this aspect of our intervention, has renewed its efforts to enhance the rollout of COVID-19 campaign, focusing on a renewed approach that is critical to enhance risk-adjusted service delivery improvement, working with the Department of Home Affairs, Employment and Labor, the South African Post Office, and Correctional Services. Enhanced rollout and facilitation of measures that mitigate against infection of service users and frontline staff, collaborative communication and public education efforts. The Provincial Department of Education is in the process to ensure the rollout of risk-adjusted examination plus the arrangement for reopening of schools, lessons from the previous approach to the reopening of schools. The rollout of broadband solution is incrementally being facilitated, especially on the sites that support education and health. However, there is a need to have a more rural focus. The Office of the Premier will release provincial circular to provide guidance on the return to work for the provincial government. According to the epidemiological report, the total number of people infected by COVID-19 in our province since the start of this virus pandemic last year in March is 187,171. Out of this number, a total of 172,623 people have recorded or have recovered from the virus. Sadly, we have lost about 9,510 people in our province. This leaves us with 5,038 active cases in the Eastern Cape province. According to the epidemiological report, the total number of people shows that our people are responding to our calls and to our campaigns, and we're quite happy with that, and we would want to commend our people for this show of force and compliance to all efforts that we are making to fundamentally disrupt the transmission of the virus. Siyabacela abantu abaziva benempawu abangaziqhelanga ezifana nobuhlungu bomzimba, ukutyhafa okugqithileyo nomkhuhlane, badibane nabongi bempilo, badibane nezibhedlele, bakhawuleze baye ezikliniki. Izawusinceda loo nto xa sikwazi ukuyifumanisa le ntsholongwane ebantwini kusengethuba. Isincedise kangangoko ukuncedisana nabantu okokuba sincedise amajoni emzimba yabo ikwazi ukulwisana nentsholongwane. We have 1,533 people admitted in hospital in our province, and in this number, 1,320 are in general wards, 150 are in ICU, 80 on ventilators, 820 on oxygen, 63 in high care wards of our hospital. Public hospital account for 1,002 in general wards, 19 in ICU, 568 on oxygen, 32 on ventilators, 46 in high care wards. The rest are in the private sector. We have lost and continue to lose our loved ones to the coronavirus, but there is hope. Scientists have finally developed safe vaccine to stop the virus. The vaccine helps us to achieve herd immunity, to prevent infections, morbidity, and mortality. Eastern Cape Provincial Government will vaccinate at about 3.7 million people from 18 years of age. Our health care workers and vulnerable people with comorbidities will be vaccinated first. Xa kugonywa abantu abaninzi ephondweni sakube sikhusela nabo bangakwaziyo ukuba bafumane isigonyo ngenxa yemeko ezithile. Kodwa kona ukugonywa kubalulekile ekusincedeni ukuba sinqande ukunwenwa kwale ntsholongwane kunye nokosulelana kwabantu. Ukugonya abantu abaliqela okanye inani elivakalayo kutheza amandla le ntsholongwane ukwenzela ukuba ithi xa izula ingafumani mntu inokumosulela. Eli chiza lokugonya liza kusincedisa ekunqandeni ukosulelana kwabantu abaninzi ukuze sinqande ukunwenwa kwentsholongwane, izigulo nokusweleka kwabantu. Urhulumente wase-Eastern Cape uza kugonya abantu abangaphezulu kwezigidi ezithathu njengoba besendichazile. Siyabacela ke abantu bakuthi bancedisane. Siza kugonya abantu ngokweziqendu ngeziqendu, uqala kwabezempilo ukuya kubantu abadala abagcinwe kumakhaya abantu abadala njalo njalo njengoko sicacisile engasentla. Sizawusebenzisa zonke izixhobo esinazo indawo ezisinokuzisebenzisa zikarhulumente apho sinokugonya khona abantu. Isiqendu sesibini sawujongana nabasebenzi abo ba critical bakwa kwi frontline like abasebenzi abangamapolisa otishara, abasebenzi bakwa-SASSA kwa-Home Affairs naseziposini, njalo njalo abasebenzi abanento kwenza nokudilishana nabantu umhla nezolo. Zonke ezo ziqendu sizawuzilandela ngendlela efanelekileyo uqinisekisa okokuba umsebenzi wenziwa ngempumelelo. The procurement of the vaccine will be done by the National Department of Health, and we will only procure the ancillary supplies. The vaccination program will be conducted over 6 to 9 month period depending on the delivery schedules of the vaccine. Similar to the IEC election program, Department of Education will make schools accessible, churches, community centers will be used as vaccination sites. Temporary vaccination centers will also be established at key points such as municipal offices, building, malls, taxi ranks, private doctors, pharmacies, private hospital, NGO clinics to make it more accessible. Mobile services will also be used. The vaccine rollout will be led nationally in close coordination with our Eastern Cape Department of Health and the private sector in our province. Ayinanyani into ethi eli chiza ekuza kugonywa ngalo abantu liyanyaniswa ne-5G kwaye sithi abantu mabangamameli amampunge izinto ezingekhoyo. Siqala ngokugonya abasebenzi bezempilo kunye nabantu abadala kuba sifuna ukukhusela bona xa kufika elam ilixa ndiza kugonywa kwaye yinto ekuza kufuneka sonke siyenzile. Uba ithethe ukuthi thina zinkokheli funeka size ngaphambili sizokhokela ukugonywa kwabantu, sizinkokheli funeka siyenzile loo nto ngaphandle kwamathandabuzo ukubonisa abantu into kokuba eli chiza silifunileyo salilolonga ukuqinisekisa uba li-right kwaye li-right and abantu balibone nalapha kuthi. Kodwa injongo zethu ayikokukhusela zinkokheli kunabantu, injongo zethu kukukhusela abantu ingakumbi abo basebenza ngaphambili. We wanted to dispel the myths and conspiracies about the vaccine with the contempt they deserve. The pandemic we are dealing with is nothing to joke about. People must desist from peddling uninformed information about the vaccine. We have a health authorities in this country that will ensure we receive a safe vaccine that has gone through rigorous scientific analysis and that has been approved by independent regulators for safety, effectiveness, and high quality. At various periods in our history, vaccines have been developed and administered to the people of the world to prevent many diseases such as smallpox, polio, measles, influenza, and many other illnesses. These vaccines were effective then and continue to save lives even today. Our children from a week after they are born receive vaccines at various stages of their growth until the age of 12 to protect them against diseases. Ukugonywa kwabantu asiyonto entsha, ukufumana amachiza okugonya abantu ayonto yokuqala. Kudala le nto isenzeka, abantwana bethu basagonywa nanamhlanje xa bezalwa. Siyacela abantu bayazi loo nto and bangamameli ezi zinto zingacacanga zithethwa apha phandle. Siyabagxeka ke abantu abenza loo nto nabazama ukwanyelisa ukudala umdintsi netyeneba ekugonyweni kwabantu. Sisemfazweni yokulwa notshaba olungabonakaliyo, sikhusela ubomi babantu bakuthi. Sicela bonke abantu bakuthi basebenzisane nathi ukuqinisekisa uba umyalezo siwuthumela ebantwini ucacile. The fact that there are vaccines does not mean people must drop and stop complying with infection control measures. Stay safe, wear your mask, keep physical distance, wash or sanitize your hands regularly. For more information about our vaccination program, people must call our line 0800 032 and 364. We have assembled our Eastern Cape Vaccine Coordinating Committee to lead the vaccination program and advise government on the vaccination program. The team is as follows. The team will be convened in the Office of the Premier by Dr. Tobile Mbengashe. Other members of the team will be Professor Kolega Mlisana, who is already part of our panel of experts on COVID-19. Professor Uwelile Shasha, Dr. Sibongile Zungu, who is an acting HOD in the department, Dr. Tutula Balfo, Mr. Siabulela Tsengiwe ozakumela abasebenzi, Dr. Bruce Jansen, we private sector. This team will be working with all the structures of the province that are currently working on the COVID-19 containment and mitigation plan. This coordinating team is a work stream of the Provincial Disaster Operations Center, which reports to the Provincial Coronavirus Command Council. We have engaged the National Department of Home Affairs, Communication and Digital Technologies Department to work with them in improving service provisions at their service centers in our province. And this is where we are very much concerned. The current queues that we see in Home Affairs are not good for our people, and we are trying our level best to mitigate and manage those queues. We'll be using our EPWP officials as queue marshals to help us manage and make sure that people sanitize. But the Department of Health, Department of Home Affairs, has acknowledged its weaknesses, and we are trying to work with them and with the minister to address those kind of problems. Some of them are structural, some of them are human resource related, and we believe that we do have a lot of low hangings that we can easily address to ensure that we manage the situation much better. Similarly to the post office, we are working with the both provincial and national office to ensure that we deal with challenges that have been actually presented out of that. And the COVID, khona la ndithi xa kushushu ngathi ayinanto ininzi edoko asiqinisekanga. So post office as well as Department of Home Affairs, they've actually collaborating with us, and we're targeting our big offices like in Mthatha, Nelson Mandela, and Queenstown, and East London, where we seem to be having problems. Because part of the problem is that if those other small offices in small towns are not functional, then you'll be forced to actually absorb numbers that are coming from those small towns into bigger cities. This is what you see in East London, that people are leaving all the other areas, coming into East London, hoping that the situation there can be actually much more better and efficient. Yes, we know our offices there have been working very well. Before this, we knew that you can apply for an ID. In 2 weeks' time, you get your ID card. So we should be able to get that back and improve the system, as we have indicated. In all of these service centers, we want to ensure services are provided to the people of our province in a safe environment so that these service centers do not become super spreaders of COVID-19. Government is improving service provision so that people don't meet at these centers in big numbers. We have noticed that many people who go to Home Affairs leave service centers in their own towns and go to East London. Hence the high numbers we see at the service center. We plead with our people to go to Home Affairs offices or service centers near them to get services. When it comes to SAPO, they've developed a new plan to manage the queues in their service centers, and they have increased number of people to receive 350 grand. We looked into what caused long queues at the post office branches across the province. We're improving personnel, technology capacity and communication with clients to ensure that people come for appointments to collect their monies and not stand in queues in the current manner. Daily transactions data shows that the capacity to process the current queues is available at SAPO. The main problem is the time that beneficiaries have to wait in queues, thus increasing their potential exposure to COVID-19. SAPO will be meeting with SASSA to further engage on the proposed areas for consideration today. Our State Information Technology Agency, SITA, is part of a collaborative effort to address the existing pressures as evidenced in the commitments already made. As government, we will provide EPWP workers to assist the post office branches to manage queues as we are doing it with Home Affairs. COVID-19 health and safety protocols is also in place to support markers, including the mitigation of infection on markers who declared comorbidity risk in all our marking centers in the province. There are 7,786 members of marking teams that were tested COVID-19, and 292 tested positive and are mostly out of the isolation period. Replacement markers came with a negative results. All visitors staying more than an hour brought negative COVID-19 results. Marking teams staying outside of the centers are in red areas. There is no outbreak noted in the marking centers. All marking centers have appropriate PPE and marking is on track for completion by the 22nd of January. With regards to the opening of schools, we all know that the Department of Basic Education has pronounced on the revised date for opening of schools, and schools will now open on the 25th January for teachers and 15th February for learners. The Department of Education in the Eastern Cape is now in the process of the revision of the risk-adjusted reopening of schools readiness plan, which includes the key elements of socialization of the education system on COVID-19 protocols and hygiene standard, interface with the Department of Health for COVID-19 support, PPE decentralization provisioning and monitoring, interface with the Department of Safety and Liaison to support school safety programs, interface with the Department of Social Development with psychosocial support, approach to scholar transport benefit, approximate 120,000 learners, hostel support program, which is long-term, school nutrition, which also takes a decentralized approach. While we continue with the mass testing in our province, we are also gearing ourselves for the vaccination program. The success of this program depends on the hands-on approach by all of us in the province. We call on the people of our province in their sectors or positions of authority to support this program. The vaccine is safe and has been tested to ensure its safety. We will never distribute vaccine that is not tested and that is not safe to our people. We have to achieve herd immunity to defeat this virus. Thank you very much.
Thank you, Premier. We will now take questions from members of the media. Let's start with those that are here, and then we'll check with those that are joining virtually. Okay. Let's start with you, Mr. Dada. No, you can speak from where you are. Use your shop steward voice.
My first question is directed to Premier with regards to the vaccination. How are you going to ensure that this process is running smoothly, the interruption or issues of corruption as we might know that in the past there was corruption? And the second question is directed to the MEC for the Education Department. Just to
Okay, thank you. X. Okay. Ndicela siphenduleni ezo. I'm yet to get questions from this side. Missing ndicela siqale ngawo. And,
Thanks, thanks, Program Director, and thanks, Premier. Good morning. Good morning, colleagues. Ever since the advent of the COVID-19 in the country, the DPE has actually created a space for it to make an adjustment strategy that does not just talk about the teaching and learning only, but also talks to the human resource placements and migration. So basically, we have made an audit. We have made an audit of those that have been highlighted by the ministry nationally, that are above 50 years, and also made an audit of those that have got comorbidities, but equally important, make an audit of those that have passed away generally in the province, and then created a dispensation of the young people that must then get into the system itself, so as to energize the system in education, but also give opportunities for them to learn through the processes that we have been putting in place. The fortunate part of the Eastern Cape DPE is that for the past 8 years or so, it then introduced two categories of aspirant educators via the Funza Luchaka program and also via the Matthew Goniwe bursary scheme and bursary program, so that we can be able to balance up the demand and supply of the province. So in essence, we are ready. We have already started that process of ensuring that when they come back on the 25th, we are closing up those spaces of those that have actually passed away. May their soul rest in peace. But equally, our challenge, which is not a challenge, so to speak, but it's a culture, I would say so. It's a culture in the sector itself, that the migration generally of the population in the country feeds directly to what you can then begins to say are the prospects of what is going to happen in education generally in the country. So in as much as we have dealt with the issue of the admissions and close it now, but I can assure you that come 25th when the schools are opened, you will get some of those few individuals wanting for their learners to be enrolled as part of the learners in the province. But generally we're stabilized, and we have been able to ensure that we close the academic year of 2020 on a good note, especially from the current developments of the marking and examinations, which is a critical question, whether are we progressively moving forward as a country or not, but equally align that with the school readiness report, which we will share with you when we finish it on Thursday, because we wanted to make sure that when they finish up the marking program on Thursday, we then issue out what is contained in that development, and how should we then make the approach moving forward. Thanks, sir.
Can you take your questions online so that you can respond to Zonke? Thank you, MEC. We'll now go to JJ. 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 Okay, there's a question about Nelson Mandela from Unomazima Premier. Is Nelson Mandela still a hotspot given in numbers zayo? We can respond to that later on. I think what JJ is unable to unmute. JJ, can you speak? Yeah. Yeah, Ted. Okay, sure, thanks. Premier.
Mhlawumbe maniqale ngaloka JJ ngoba ngathi wona noko ngumbuzo ongekho relevant kulento sizothetha ngayo apha kodwa ke because umasipala xa engasebenzi inkonzo azizokuya ebantwini. We are attending to the problem of Amathole and at an appropriate time MEC Cocta will brief the public. We are doing our part working with National to make sure that we intervene, and we will be intervening in Amathole decisively to ensure that the institution is back to normal and stabilized and is normalized, and we improve the services, basic services to our people. So that's the situation around Imeko Yase Amathole. Yes, of course, the Office of the Premier, through the MEC of Cocta and the department, it is part of that, and we had a meeting with National. We're working with the Cocta National as well as Treasury National, together with the Treasury here in the province, to find solution and try to get the municipality back to normal. Uhulumende African National Congress is unfortunate that there is a deliberate attempt to make it synonymous with corruption. And every time people think about things that are happening to people, they think about this. Vaccination is not for the first time. We never had corruption in other vaccinations. We've been vaccinating people in big numbers. We've got big numbers of our kids that are being vaccinated. There are systems that are in place about this, and even the very same systems and mechanisms that are here in South Africa fighting corruption are mechanisms that have been brought about by our constitutional democracy system, which is a system that has been brought to our people by the African National Congress. ANC is an anti-corruption movement. It will continue being like that. It will continue to deal with elements that show this kind of rapacious behavior that we continue experiencing in our midst. So definitely we are not going to allow it. We have seen a lot of cries and the halabaloo about corruption in the first phase, in the first wave. We've called for government institutions that are dealing with corruption to come forward and help us on that. This time around, we're setting up systems to ensure that we don't create a chance or create a space for any kind of attempts and corruption-related activities. This will be procured nationally. As I've indicated, that we'll only be procuring the kind of an ancillaries to the main program. So no panics around this issue. We're definitely alert, we're definitely aware. And I say it in every meeting, in EXCO, in the Provincial Coronavirus Command Council, HOD, everyone involved knows that we can't continue having this debate of corruption as if we are stuck with corruption. We've got to deal with it, make it a point that one by one, we get rid of corrupt elements in the system. So that's commitment that we have. So it's always bad when you hear this, people always creating this impression that corruption is synonymous with the ANC, synonymous with ANC government. Not at all. We are not government for corruption. We are government of the people, for the people, by the people. And we are expected to make sure that we put our people first, and whoever does something opposite is actually not representing the government of the African National Congress. So I think that one should be very clear to everyone out there. Yes, Nelson Mandela, we could say so, but we don't want to make it at this point in time. I think we want to continue relying on our epidemiological analysis, which continues to guide us on this. Yes, numbers are dropping. The fact that there are still people who are still COVID-19 or still carrying the virus as active cases in Nelson Mandela, that worries us. We would want to drop it very far. To talk about 300, that number is still huge. It can bring about another third wave, if there will be a third wave. So we really careful about what we are trying to say. We're quite happy that numbers are dropping drastically. I know the next question will be, when are you thinking about adjusting or relaxing these regulations in Nelson Mandela? We don't want to take chances about people's lives. We just want to make sure that everything actually is in order. So we're dealing with that from that angle. So the scientists will tell us when Nelson Mandela is no longer a hotspot. Currently, Nelson Mandela has got numbers, but numbers are showing that kind of a downward spiral trend, which we are quite happy about it. Thank you very much.
Thank you, Premier. I think that was the last question. Usafuna more? Okay. That was the last question. There are no hands on the. There are no hands on this side on the virtual platforms. So we've come to the end of our media briefing. Thanks to the Premier, MEC Gade, and colleagues that are here, and MECs that joined via the Microsoft Teams. Thank you very much. Have a beautiful day. Oh, there's one hand that is coming up. Nomazima, unmute her, this is the last hand. Hello? Yes, speak or forever hold your peace. It plans about filling the vacancies and number of people that we have lost to COVID-19 as the department. Yes. Ileyo, okay. Ubuthini ngale complaint? Okay. Okay. Talking to him.
Once more, thanks, Program Director, and thanks the Premier and the listeners. As you would know that we unfortunately have lost a number of the personnel, including the HOD of the department. Let me probably start there, Program Director. We have started a process of recruitment, and we have talked with the Office of the Premier in that particular regard, because in terms of law, the appointment of the HODs lies with the Premier's office. The Premier is the one that becomes the custodian of appointing HODs. But I can safely say we have already appointed the acting SG. There he is, Mr. Chwakati, is acting now up until the Premier feels reviewing that particular process at an appropriate time. We have already given the districts, because post-level ones are not appointed in the head office in education. They are appointed by schools via the SGBs and also the district director at that level, so as to cut the red tape of a recruitment plan of Department of Education, so that we don't waste time now. So we have already issued that circular, and we have already put in a process that is going to be issued out through the circular by the acting SG in the context of activating the first quarter bulletin, wherein all the vacancies will be dealt with and be finalized at that particular level. So what I can safely say, Program Director, is that come the 15th of February, would have finished up that process. That's the reason why we have said, as the DBE, create a transitional period between the 25th of January and the actual activation of teaching and learning in the presence of those that are regarded as learners. So this period between now and the 15th deals precisely with administration of schools, with all the logistics that would be required in the context of the COVID-19 regulations, but also deals with this issue of recruitment so that we finalize it up. Because if we'd have not done that, we'd have a problem of learners coming in without sufficient personnel to taught them. So that's the commitment that I can make, that the process has already started. The acting SG is finalizing the circular. It should be out before Thursday to all principals of schools in the province and also the social partners that we have. They have also engaged the social partners, by the way, on how to activate the process of ensuring that our institutions of learning are indeed have all the necessary requirements, including the personnel in the form of teaching and also in the form of the EAs that has been appointed via the Presidential Youth Initiative. We have appointed more than 50,000 young people in the province, which are spread across all schools in the province to assist in that particular regard. Thanks.
Nkosi Mphathiswa, we've come to the end of our press conference officially now. Thank you very much.